This feature is brought to you by JPH MP Direct, the companion site of the Journal of Public Health Management and Practice.
All right, thanks for joining me again for another episode of Views from the Front Porch, a podcast series about physical activity in rural America. My name is Christiaan Abildso. I'm an associate professor in the School of Public Health at West Virginia University. And today I am joined by Lisa Charron from the University of Wisconsin Population Health Institute in Madison, Wisconsin. Welcome, Lisa.
Hi, thanks, Christian. I'm happy and honored to be part of this series.
Awesome. Would you please just tell me a little bit about yourself and your reason for interest in physical activity in rural places?
Sure, yeah. I'm a PhD student at the University of Wisconsin-Madison. And I'm sort of connected to a few different departments here. You had mentioned the Population Health Institute. I've been working with them for several years and worked on a bunch of really cool projects with them. My background is in the Masters of Public Health program and the Masters of Urban and Regional Planning program. But now my PhD is in Environment and Resources, which is an interdisciplinary program that helps me connect those two fields even further in my PhD work. So I pop around between a bunch of different departments.
That's awesome. Rarely is the path ever straight, especially.
Yeah.
I know that
Exactly.
from here. Well, of course, you and I both have beautiful windy days. Should be perfect for recording. So a nice spring day in Wisconsin for you. So that's pretty awesome. So what's your, the most important question here, of course, is what's your favorite physical activity? What do you like to do?
Yeah. Sure. And I've watched some of the other episodes. It seems like people don't decide on just one. So I'm going to go with three. That seems like what others have done. Madison's a really good biking community. There's bike paths everywhere and you can get wherever you want to go. And so I love biking around town, whether it's, to work or shops or to the bars. This is Wisconsin. So probably the one I do the most. I've also been horseback riding since I was 8 years old, and so that's one passion of mine, and I'm lucky I can continue to do that even though I don't have my own horse. And then lastly, I've gotten pretty into disc golfing. There's a bunch of really beautiful courses around here in Dane County, and so I like just being able to go out into the park with some friends and throw some plastic around. Those are probably my top three.
What part of the country are you from?
I'm from Connecticut.
Okay, very good. Beautiful area. I have family there.
Yeah.
Yeah, so thanks for telling us about that. It's good to know your background. You have a really cool background in planning and public health and now the environmental resources PhD. So a number of us, as this sort of sparked this series, a bunch of us co-authored this call a call to action for rural active living that was published, thankfully, by JPHMP. It's about 4 years ago now. So we concluded with the call to action with 8 suggestions, including a couple, maybe 2 or 3 I'd like for you to talk about. So the first one, I'd love you to talk a little bit more about comprehensive planning and your work in adapting what was done in an urban or suburban context and adapting it to rural places, because it hits our call to end the practice of treating rural settings just as less populated urban places, because they're so unique socially, culturally, and environmentally. So tell us a little bit more, especially for those uneducated, about comprehensive planning. Talk a little bit more about comprehensive planning and some of the work you've done on that.
Sure, yeah. I love talking about comprehensive planning, so thanks for asking about it. This is a big part of my dissertation research I'm working on, and it was the core of my master's work as well. So for your audience, a comprehensive plan is sort of this big long-range plan that a municipality will have, some counties have them as well, and some regions have them. And they really guide the physical development of a community, as well as the social and economic development. They touch on lots of different sectors, so transportation planning, planning for housing, parks and recreational planning, and they have to be in line with the zoning code usually and the codes of ordinances. And sometimes they're called master plans or general plans, so you might hear them referred to as that as well. In Wisconsin, they're actually required by state statute, even for really small communities. And so it's a good place to be studying them. It's not true in all states, but I encourage everyone to go look up if their community has a comprehensive plan and what's in it, because it'll be a plan for the next 10, 20, or 30 years for your community. So it can be pretty interesting to dig into, I think.
Those policies are state level about how often they have to do them, right? And what has to be in them. Is that right?
Yeah, that's right. So for instance, Wisconsin state statute about it, they have to be updated every 10 years. And that doesn't have to be like a full update. It could be just going in and changing some of the zoning codes and some of the policies and then readopting the comprehensive plan. But a lot of communities write whole new comprehensive plans every 10 years, sort of to reflect changing conditions in the community, whether it's different economic factors or different population factors. And I like studying them because it's a document that gives a glimpse of like pretty much the entire community and what policymakers want to see happen and what their vision is for all these different sectors throughout the community. So I set out.
Yeah. Tell us a little bit more about what you did with that plan, I think from Delaware, right? Folks in Delaware
Sure,
did that you adapted,
Yeah, so I sort of set out to assess the extent to which municipal comprehensive plans in Wisconsin contain strategies and recommendations and goals that encourage physical activity and also healthy eating. And right when I was setting out to do this work, Nemours Children's Health had published this scorecard for comprehensive plans, the Healthy Living and Active Design scorecard for comprehensive plans. So I said, great, there's already a pre-existing scorecard. I can just use that on the plans in Wisconsin. But as I was looking through the scorecard and thinking about, I came from a small town in Connecticut and I've visited a lot of rural communities in Wisconsin. I just couldn't see applying this scorecard to those communities and it being a fair assessment, especially then comparing them to urban communities like Milwaukee and Madison. And as I did a bit more digging, it was even more than that. It was that the evidence for the planning strategies and urban design strategies in the scorecard, that evidence had been produced mostly in urban and suburban settings, and then just sort of applied to communities broadly, meaning all communities. And we know that there are big differences between rural and urban communities as far as, things like land use, but also things like culture and economic development and population changes. And so the precocious master's student that I was, I thought, hey, I can fix this. I can make my own scorecard for rural communities. So I did. And the way I did that, I started with just a basic literature review. There's not that much literature on promoting active living and healthy eating through planning in rural communities, but I drew from a lot of different sectors and fields, and that really helped. The EPA has some really good smart growth resources for rural communities, so I drew heavily from that. And then Safe Routes to School has some good rural specific resources, so I drew from them. And so once I had done my literature review, I adapted the scorecard, sort of version 1. And then I reached out to a bunch of rural practitioners, both in planning and public health throughout Wisconsin. And I did some focus groups and some workshops. And that's where I really, I learned the most, I think, from those. I gave them the scorecard and asked them some protocol questions, and they gave me feedback both on the content of the scorecard and whether the strategies were feasible and effective in rural communities, but also the usability of the scorecard in a rural setting. So I learned a lot from that. And so some of the sort of strategies in the scorecard we just had to eliminate. Some of them we had to adapt for a rural setting. And then sometimes we added whole new strategies because rural communities have certain strengths and assets that urban ones do not have for active living and healthy eating. I can give an example of some of those if that would be helpful. Yeah.
Yep. Yeah, you want to hit one? Yeah.
Sure. So for instance, when it comes to active transportation, I think this is an area where things look very different in urban settings, and the policies and the strategies look really different in urban versus rural or suburban settings. So the language around urban design for active transportation is, complete sidewalk networks and complete bike path networks, and sort of every street has to be walkable and bikeable, or most streets do. And in a rural setting, it seems like it would be more effective to sort of connect these critical points of activity. So if there is a subdivision, you might want to connect it to the school with an active transportation route. Or if there is like a core downtown, like a town center area, you might want to connect it to a park or a natural area, or back to that subdivision, or different places people live. And so it's less about blanketing the entire area with biking and walking infrastructure, and instead making these critical connections. And even the urban design of planning for walking and biking looks different. So it might be bike paths in an urban area, but in a rural setting, it might be something as simple as like a paved shoulder. And actually, I learned from rural practitioners that serves the dual purpose of widening the road for agricultural equipment to get by. So you might have like a pretty broad base of support for a change like that. But also rural areas, sometimes it's just a matter of like wayfinding signage on small rural roads that don't get a lot of traffic. So it's both the overall strategy of what the network looks like, and then also the sort of streetscape level urban design has to be pretty context sensitive. So we sort of embedded all that language and those strategies into the scorecard for rural practitioners when they're doing their comprehensive plans and they're doing their transportation planning, to think about what they're doing already to support active living in that way, and some ideas for what they might want to work on in the future.
Yeah, that's a great example of what works in a rural context too, because I think our transportation officials here are very worried about rollover crashes. Therefore, widening the shoulder for coal trucks and timber and other could be a victory for people that like to ride their bikes up mountains too. So yeah, that's a great example. So and I know I actually, as you know, I used your comp plan scoring tool and kind of pilot tested it with some planners here in West Virginia, and they really enjoyed it, especially the mayors that I talked to said it's a great way to start a conversation about how, not like showing how bad we are, but what cool things we could do.
Yeah, that's awesome.
I could talk about this stuff all day, but there are a couple. There's one other point. As we were talking a little bit, your work, obviously, it also hits another call to action, planning for which is like the third in our list, recognizing and planning for the diversity that exists within the continuum of rurality. But you also did some qualitative work on that. So, in the few minutes that we have remaining here, I'd love to hear more about your experiences, either on the qualitative work, learning from people in the field, or the more about the diversity that you experienced when you went out to all these different communities in Wisconsin.
Sure, yeah. Honestly, I've struggled a little bit with the third call to action, recognizing and understanding the diversity, and sort of melding that with developing some generalizable guidance for rural communities, because that's sort of what I've been focusing on. Is I've heard from rural practitioners, oh, none of this guidance coming from like the Plan for Health movement or active living movement, none of it is useful for us. And so developing some of that generalizable guidance is sort of what I've been going after. But then it's not generalizable to the diversity of rural communities who have, they range, even in Wisconsin here, we have agricultural communities, we have communities that focus primarily on tourism, we have ones that are adjacent to metropolitan areas and ones that are very remote. And so I have gotten feedback that rural scorecard, I don't know if you could hear that, but there's a big truck that just went by.
That's okay.
Yeah, so I think what I've come to do is sort of messaging around the scorecard, and then also around some of this, I'm doing some health in all policies, like technical assistance and training. And it's about messaging that like you're providing sort of this compendium of strategies and resources, and it's up to a local team to figure out what from that is going to work from them, and offering the training and support in order for them to do that, and the training and support for community-driven policymaking and planning. And I think that's sort of, in my mind, providing that support for more and more rural communities. That's how we're going to get to understanding the diversity of rural communities and understanding how planning for health or health in all policies or promoting active living, what do those look like in different specific types of rural communities? We have to create those interventions across a lot of rural communities in order to understand that. So to me, the first step is just doing that work in more rural communities, and then learning from that work and learning from the people doing that work. That's sort of like my reflection, my takeaway. But
yeah, that's awesome. I mean, yeah, the hardest part I think is having that consistent entity that is allowed to do that, right? It's kind of a luxury that you have that. I know we have one here too, like a planning center here at the university that helps a bunch of the rural counties and towns. Mm-hmm. So yeah, I mean, that's awesome. And I think you're getting to, it sounds like you're getting to a place where you can even sub-segment the rural populations and find patterns in those sub-segments. So
yeah, a little bit. And that's what that, there's this big health in all policies project. You know, it's not all rural communities in Wisconsin, but we have enough rural communities. We're doing some evaluation efforts on what it looks like to implement health in all policies in those communities. And yeah, we're getting a little bit of that nuanced understanding. So it's pretty exciting.
Yeah, that's awesome. Well, you know, I think we're running up against time here, but this is really cool work. And it's, you know, I'm glad to see it's still winter in Wisconsin.
Yeah, well, we had
actually it's kind of warm, right?
Yeah, I mean, we had a teaser of like 60-degree weather, so now 35-degree weather seems really cold to me.
Yeah. Well, I think it's really exciting to see your work. I think sort of the up and coming rural practitioners and researchers, it's great to see your work, and looking forward to see how things go with your dissertation and all the really cool stuff you're doing. I'm sure you are too.
Yeah.
You're excited to see how it goes. I think what I'll do then is sign off on this view from the front porch or back porch. Is yours your front or back?
The front porch, yeah.
Front porch. I got my back porch here. So yeah, well, it was great talking with you. I look forward to all the work you're doing and seeing the fruits of your labor there.
Yeah, thanks, Christian.
Yeah, it was awesome. Thanks for making time. Sure
thing.
This feature has been brought to you by JPH MP Direct, the companion site of the Journal of Public Health Management and Practice. To learn more about the research presented in this talk, visit us online at jphmpdirect.com.